Carl John Rossi. I'm the medical director of the California Proton Cancer Therapy Center in San Diego. We're an affiliate of UC San Diego, so we're based in San Diego. So my topic here was to talk about what we call azure prostate cancer, which is those patients that have locally advanced disease and are at high risk for having micrometastasis. And the talk discussed what that is, how it's defined, how those patients are treated, and what their options are for treatment. Not in this audience. This is the third or fourth time I've talked at PCRI, I think since about the mid-2000s, and I invariably find the audience to be highly educated, and as a consequence, of course, they ask some very sophisticated questions, which is great, and we all like that. So in the radiation field, there's a very early work being done on this subject called flash therapy, where we give a very high dose of radiation in an extremely short period of time. This is really still preclinical. It's based upon a lot of cell culture work that says, hey, if you do that, it doesn't hurt the normal cells, but it hurts the bad cells. Potentially, that is an area where radiation is going to play, will change, there'll be a major role for it. I think a second area is the use of radiation, and in particular proton radiation, to help get the abscopal effect, or where you irradiate a tumor to liberate a lot of tumor antigens while at the same time you're doing something to try to ramp that patient's immune system up. And you can, by giving the immune system more to look at, it does a better job of hunting down any other disease that may be present. There's some preliminary work from MD Anderson suggesting that while you can certainly do this with X-rays, you can create that effect with X-rays, the effect is somewhat stronger if you do it with protons, because you're not treating as many of the circulating lymphocytes that are in the entrance or exit paths of the X-ray beam. So from the radiation standpoint, those are two areas I think are pretty exciting: flash therapy and using protons to help accentuate the abscopal effect. Medical oncology, there's a new development every month, which is even better. If I were to look at just one thing, I'd say that I think the emerging investigations of the role of immunotherapy are really exciting. The reason for wanting to do it is it further reduces the entrance dose, because you're not just treating through one static field. It has become technically possible, and it's being done not on people yet. Right now it's still in the phase where you radiate a phantom, some type of a recording device to see what type of dose you get. But William Beaumont Hospital's Proton Center has been working on this. Varian, who manufactured our equipment, is working on it at a facility at Proton Center in Denmark. And it will be hopefully ready for us all within the next half decade, if not sooner. And it'll be very retrofittable. So all of our machines as they currently exist, all the newer generation of equipment, will be able to do that. But it's just now getting the software and getting things to where we can deliver treatment while the gantry is in motion. That's going to be the key. But it's another way to further reduce harm by limiting normal tissue dose. I think the patients continue to do and should continue to do an excellent job of educating themselves and not being afraid to ask their physicians pointed questions. That they need that information, and the information is not top secret. And having able to have a dialogue with the physician is important. I learn a lot. I get papers from patients I've never heard of. I see data that I wasn't aware of because I don't have time to focus on all those different things. So encourage the patients to be that resource. It's not only for themselves but for other people.